As a main author, I, Fernando Salvetti, declare that I do not have a conflict of interest nor financial relationships to disclose. And I can say and declare the same on behalf of my colleagues and co-authors, Roxanne Gardner, Rebecca Meinert, Barbara Bertagni.
Welcome to the Digital Learning Workshop. We are happy to be here with you today. Our focus is about tele-simulation and online cooperation. The key questions are, how can we design engaging and effective online learning? How can we perform tele-simulation? How can we make digital learning authentic and not overproduced? How can we apply gamification strategies to enhance online cooperation? Last but not least, is avatar-based role-playing something useful?
Hello, my name is Fernando Salvetti. I'm a founder and managing partner from Logosnet and a co-designer of eReal. Let's keep some thoughts about the avatar for the end of our conversation. And please, let's start meeting Roxanne Garner, and let's jump into our platform.
Hello, my name is Roxanne Gardner. I'm an OBGYN physician at Brigham and Women's Hospital, and I'm the Senior Director of Clinical Programs at the Center for Medical Simulation in Boston. I'm delighted to share with you today a brief, condensed video of a beta testing we did using the initial online version of eReal. Prior to COVID, at our center, we had an enhanced reality laboratory system which was existing in brick and mortar in a room. With the COVID experience, we had to transition quickly to an online version. Here, we have gathered a team of interprofessional clinicians to practice organizing themselves to manage a crisis using a paradigm called name, claim, aim. You'll also hear at the end from these participants their thoughts and reflections about their experiences.
Pavan, I'll step up.
Okay, Pavan, great.
Bram, I'll play too.
Okay, Bran, wonderful.
This is Catherine. I'll play also.
Okay, you got a little bit of a team here, Pavan, going. So
let's try AE. No idea what that stands for.
AE.
Pavan, Marjorie, I'm on your team too.
So I guess trying to apply the name, claim, aim role. Name would be that we're out in the wilderness, and if something were to happen, let's try to claim some roles. And I guess since I'm continuing to speak and I started, I'll be the event manager. Catherine, what role would you be able to take?
I can do CPR.
Okay. And Bram?
I can do airway. I'm the one person who has a little mask here in my pocket.
And I'll do circulation or stabilization of acute injuries that might occur.
Okay. If I could have one more person help out with calling for help, because I think out in the wilderness, that'll be more important than any of these other things.
I'm wondering about equipment. What emergency equipment might we have thought about that we have already?
Roxanne, do we have any equipment or?
You don't have a satellite radio, but you all have your cell phones. I'm not quite sure what the signal is reachable in this wilderness area, but I guess you'll find out. And there's at least a couple of you who thought ahead and had first aid kits.
Excellent.
Okay, typical for what you would do with hiking. You ready to start the video?
Sure.
Okay, ready to go on the hike.
So there's water.
Okay. Lots of different things could definitely happen here.
Okay, pause it right there.
So of course, being an ER doctor, I kind of look at myself as going to the foot of the bed. And if I could have the team assemble around the patient, the foot of the patient. And I guess let's start out with, we have potentially an injured patient is the situation. She's screaming. And so if we could have our team assess the situation.
I'll go to the head and take airway and talk to her, try to calm her down.
I can assess the circulation.
And Marjorie, if you could examine the patient.
Okay, so I'm trying to check out what's not in our view.
Yep.
You can assume she has an injured ankle.
Okay, and is there? I would like to do a little further assessment. Is it pulseless? Does she have a pulse?
She has a pulse. She's responsive. She's screaming. She's crying and moaning.
Okay, so I am reporting back the information that we found in our assessment to the leader. The question, and I'm wondering if it seems like she might not be able to walk and continue on with us, so we need a plan. Thinking the next step might be to get a plan for how we're going to get her out of here.
Okay, and so Marjorie, if you could call for help, can we try having someone call their phone, use their phone to call 911?
I have no signal.
You have no signal. Oh, come on, Bram. So you have someone with a different service?
I have a signal.
Oh.
Thank you, Catherine.
And I noticed that the wound on her forehead is just a bruise, but there's actually a bleeding cut at the back of her head. So I'd like to request the team's input on what to do about that, because I think we need to try to preserve her circulation.
I think we're going to be looking to calm her down and talk to her. And it looks like we may have a leg injury and maybe a head injury is what we're sizing this up as. And so our plan is to ensure that we're safe around us. Thank you, Elaine, for that. And access help. So Catherine, you were able to get signal. Did 911 respond to you?
They did. They're going to try to get a team out here. There's nowhere to land a helicopter, so they're going to have to figure out where they can land and how far they'll have to hike in to retrieve her.
Excellent. I'm going to end the scenario. Thank you very much. So, what are your reactions, initial reactions?
It was amazing how real it felt in terms of kind of the stress of trying to figure out what we had available to us in terms of resources and how we were going to figure out the patient's injuries.
That's great.
Yeah, I mean, I think I will say common technology as well. The full screen interactive piece definitely does embed you in there and creates an element there. But I mean, it was definitely great having a team and be able to talk through it.
Hello, it is great to be speaking with you today. I'm Dr. Rebecca Meinhardt. I'm an anesthesiologist. I specialize in obstetric anesthesia, and I practice at the Massachusetts General Hospital in Boston. I also am a simulation educator, and I direct the anesthesia clinical courses at the Center for Medical Simulation, also in Boston. And I also am the network simulation officer for the Massachusetts General Hospital. I was very excited when I started working with Fernando and the eReal platform, because it just afforded a level of engagement for our participants learning these challenging applications of crisis resource management skills. And so in particular, this paradigm that we teach now, the name, claim, aim mnemonic, to help people apply the crisis resource management principles more in an organized fashion. That was a little bit more challenging to do before we started using eReal. And I used to use it in a brick and mortar fashion, which was very engaging, where people could actually interact with the scenario that was broadcast on the wall. They could touch the screen. It was very engaging. Now that it's moved to an online platform, I'm really excited, because I do feel like there's a lot more opportunity to reach people and to have them practice these very challenging skills that are challenging to apply anyway in the midst of a crisis. And so I'm really excited about this possibility, and especially using avatars and being able to slow down, speed up, pause videos and engage people in a wider audience in a virtual platform is really exciting.
Rebecca, I'm really happy to be with you today. And let me please ask you something that, in my opinion, could be very important also for all the people that are with us. which problems this platform may solve from a medical simulation perspective. Do you think other people may benefit from the same platform or not? Take the liberty to be very frank.
Yes, so I always like to be very frank. I think that the medical community can really benefit because of the wide range that people can engage within the platform. It can support multiple learners at once. You can have a lot of fluidity with who is engaging in the actual scenario. You can pause and engage the whole group to debrief. It's more interactive than just, say, watching a video, where that's sort of what we're limited by right now with the pandemic ongoing. And I don't see the virtual environments going away. In fact, I see them only being used more because of their vast utility. For the non-medical purposes, I can see a lot of benefit, because this is the kind of platform that you could use for communication, teaching, leadership. You could introduce these, crisis resource management principles may look different in different specialties, but elements of leadership and inclusivity, problem solving in a dynamic fashion, getting lots of voices and cognitive diversity in the to generate solutions. I think that's all applicable to many fields. And so that's the type of platform that this supports, that eReal in a virtual platform supports. And so the content may look a little different, but the principles remain the same. And I think it just has wide applicability.
Thank you. Very, very important having you sharing with us your insights.
Yeah.
Allow me, please, for a second question about the future scenarios. Which directions, in your opinion, we have to follow with our platform development that could really fulfill your needs as a simulation expert and educator?
I like the ideas that you're exploring with the diagnostic reasoning and investigation of patient scenarios. So, for example, having a person be able to be interviewed using footage collected from real patients or even generated on computers. I like that idea for new learners. I think that there's a lot of opportunity there, and especially if it could be used for boosting, for example, medical students or new physician assistants or anyone who's just sort of coming into the clinical field, especially in early stages, to look for how do you ask questions of people, what are you looking for, how do you hone your diagnostic reasoning. I think that that's really great. I see that the opportunities to really engage in learning how to manage and organize around medical crises, those are applicable, I think, at all stages. In fact, I've started teaching or facilitating simulations using even the most novice learners to sort of open their eyes to crisis management principles and leadership opportunities, even with brand new interns. However, that's all done in person with only small groups. And so the level of discussion is, I think, a little limited by the small size of the in-person groups. And this would afford much more rich discussion, I think, because more people would be able to engage. So that, I think, is very exciting. The one challenge I will just say with any virtual environment is that as a facilitator in simulation, being used to observing and in-person, debriefings, those kinds of things, there's a lot of subtle nonverbal cues that go on that I have missed when I have moved a lot of my teaching into the virtual realm. And so that, I think, is just a change that we as educators have to consider, that there might be a tense moment that we might miss because we can feel it. We have other sort of senses. We can sense that more in an in-person event, whereas we might miss things in a virtual event. But that just makes our job different because we will just have to be more deliberate about investigating those kinds of things. So, but otherwise, I think that the future, the future is very bright for this type of environment. And I think all of our problems, many of our problems relate to not being able to reach enough people at a convenient time. And this solves a lot of that in a very engaging way.
Thank you. Thank you. So now, what next? avatars.
We at eReal are excited to introduce Louise, a newborn digital human, to the workplace. Louise is designed to simulate real people with real personalities and real emotions. Her versatile attitudes are essential for recreating ultra-realistic interactions through a virtual environment.
Hello, everybody. My name is Barbara Bertagni. I'm a psychologist, founder, and managing partner of Logosnet. Fully agree with our avatar Louise. The key idea of our work is allowing learners to have real interaction in a virtual environment. From a psychological point of view, what I love in this solution is that real people work together as a real team, interacting in a natural way without wearing glasses or headsets, and the technology is user-friendly. This makes the learning authentic and not overproduced. We are happy to see learners engaged in the simulation. What we are doing now is measuring the learning's outputs. If you are interested in our research project, please join us at info@logosnet.org. Thank you very much. I hope we'll see you soon.